The calls for increase in budgetary allocation to the health sector have become increasingly urgent, especially with dwindling health indices. Analysts say the indices could remain poor except government commits to investing in the sector, especially the 2018 budget.
30 CSO organizations signed an open letter to His Excellency President Buhari asking for an increase to the health budget. So even if we don't get to 15% this year, let's at least get to 7.5%. We also asked for the 1% consolidated revenue fund to be implemented for that basic minimum standard. As we speak today, neither of those things have been done.
The National Health Act is actually putting money where it should be, and that's at the primary health care level. 45% of that money will go there. And the vast majority of the resources coming from the 50% to National Health Insurance Scheme would also go there.
Setting up monitoring and accountability teams to reactivate implementation of the National Health Act is another viable solution the CSOs want executed.
It's not enough to ask for more money for health. We have to ask for transparency for healthcare, because we can get more money, which is important, but at the end of the day, how is that money spent?
We can have 2,000 press conferences, but we must go beyond that, because that's why we try to draw a linkage between our action or inaction to an outcome.
They are also calling for the engagement of state-level actors in domesticating and operationalizing the National Health Act.
So, Mr. President, we're raising our voices to ask for more resources for healthcare, in particular for the Basic Healthcare Provision Fund, in order that Nigerians get basic minimum standard of healthcare.
For health analysts, investing in the Basic Healthcare Provision Fund, as provided by the National Health Act, will ensure that poor Nigerians can access healthcare freely.